wife of the governor of Cross River State, Her Excellency Dr. Linda Ayade, has delivered a health talk in the first meeting following the COVID-19 pandemic lockdown of the Southern Governors Wife Forum, Sgwf, also known as Sisters Beyond Boundaries, in Asaba, the Delta State capital. The body, which aims to foster unity and support projects of wives of governors from each member state, is the umbrella body for the wives of governors from the 17 states of the southern parts of Nigeria. The event, which lasted for 2 days, started with a closed-door meeting of the governor's wife. As the only keynote speaker at the event, Dr. Linda Ayade gave her health talk on the topic, the importance of eye care, by summarizing the key point to 4 P's, which included prevent, protect, preserve, and prioritize for easy comprehension.
Your mama here wants you, her beloved Delta women, to hear more about caring for your eyes and preserving your sight. This is informed by the alarming statistics that is rolling in annually on sight loss. Is a thing of concern for us, and therefore we have to heighten the awareness. Sight loss, as you have watched from the drama here, is a very terrible and dreadful thing, also known as blindness. That word, the word alone, sends shivers when I try to imagine and think about it. We know the very importance of our eyes. The eyes are the windows to your body and to the world. You cannot do without them. I'm not saying that you can do with any other part of your body, but the eyes particularly are very important. Globally, these statistics that I'm talking about, globally, we have at least 1 billion people with near or distant vision impairment. And that figure, out of that figure, a whooping percentage, up to 90, can be prevented. This affects people of all ages, but however, a higher percentage is over the age of 50. These figures I have just mentioned could occur as a result of diverse health conditions or medical categories. And these categories, I will quickly list some, and the very common ones that we have around in our environment. We have cataract, we have refractive errors, we have cancers, especially childhood cancer. Retinoblastoma has been rendering our children blind from a very tender age and will leave them with that permanent impairment, blindness, for a very long time, the rest of their lives. Trachoma, we all know trachoma. These are all common diseases around us. And then we have some secondary causes that could also lead to blindness. Hypertension is topping the charts on that list. We have high sugar levels, diabetes. I believe that a lot of people seated here, or everybody seated here, knows that word diabetes is very common, just like hypertension.
While speaking on the first P, which is prevention, Dr. Ayade said dieting was critical as some nutrients like zinc, omega-3 fatty acid, vitamins, and proteins are very good for the eyes. She then gave names of food that these nutrients could be found in, which were Spanish, water, bitter leaves, cucumber, corn, grapes, carrots, oily fish, nuts, seeds, etc. She advised them to try and spice up their meal with more of the food listed above and move away from our traditional carbohydrate-based diets. Speaking earlier during the courtesy call by the wives of the governor, His Excellency Dr. Patrick Okowa welcomed the women and thanked them for choosing Delta State to host their meeting.
I'm truly delighted this morning to receive you, and I'm glad I have the opportunity to meet with you. Praise God. I also thank you for all the activities yesterday. I'm truly very glad that you're meeting and that you have decided to work together as sisters beyond boundaries, because I saw when I looked at the things written that you have one shared vision, which is very important. And I do know that your vision is not only to associate yourselves, but to make life better for Nigerians, particularly for the girl child, and also for the women in our country, Nigeria. I truly want to welcome you once again to Delta State and thank you for the association that you put together. More importantly, when I do realize that women are first ladies, have continued to mobilize resources in their own spirit to assist their husbands in the conduct of affairs of their various states.
While briefing the governor on the purpose of their visit, and later, while speaking to the women of Delta State, the chairman of Sgwf, Her Excellency Mrs. Kafayat Oyetola, wife of the governor of Osun State, thanked Governor Okowa for the various people-oriented projects he was doing in the state. She said the association was formed to support projects of wives of governors in their various states, to complement efforts of government, and to unite and fight for social justice for women, children, and society at large.
And thank you very much for giving us the opportunity to have our first inaugural meeting in the state. Since the inception of this forum, the ESO, Delta is the first place where we have our inaugural meeting. We thank you very much at the entire crew of Delta for the warm reception we received from you. Mr. Governor, I thank you very much for the various people's-oriented program you are doing in the state. Mr. Governor, the Southern Governors Wise Forum, it is the largest group of Nigerian Governors Wide Forum. The forum engaged in programs in their respective states. We are to complement our husbands in their efforts in the states. We have joint programs. We have a lot of programs that we are doing in our respective states. One of the joint programs we embarked on recently, when we discovered that there is an increase in rape cases and gender-based violence in Nigeria, we decided to embark on GBV, gender-based violence, as a joint program. And to the glory of God, the cases of rape or anything related to gender-based violence has increased.
I bring you greetings from the good people of Osun State. I am particularly delighted to be here with my sisters as this eye care outreach takes off. I thank her for the commitment with which this intervention is being carried out.
In her welcome address, Her Excellency Dame Edith Okowa welcomed and thanked the wife of the governors for accepting to come to her state. Dame Edith told participants that Sgwf was made up of 13 states, 3 geopolitical zones, 3 parties, but one vision, which is to reach out to the less privileged. She said she was privileged to host the first inaugural quarterly meeting, which she said had not held physically since the COVID-19 pandemic lockdown. Dame Okowa said they had come to leave a legacy in Delta State through the various projects of her husband's administration. In the area of her intervention, she said she chose the healthcare service delivery, which she does through her NGO, the 05 Initiative, with her main focus being on sickle cell intervention and other medical conditions. But for that day, she said they were providing medical interventions of eye care services ranging from surgery to provision of glasses.
Thank you so much for accepting to be part of our state for just one night or two. God bless you real good. We've just had an introduction of what we are like. We are 17 states. That is the Southern Governors' Vice Forums, made up of 17 states, 3 geopolitical zones, 3 parties, but one vision. That is the vision. To elevate, to see that there is no person that is crying, to reach out to the less privileged.
Present at the event were the wives of governors of Osun State and chairman of the Sgwf, Her Excellency Mrs. Kafayat Oyetola, Delta State, Her Excellency Dame Edith Okowa, Cross River, Her Excellency Dr. Linda Ayade, and those of Akwa Ibom State, Edo State, Ogun State, Ekiti State, Ebonyi State, Enugu State, Imo State, and Ondo State. Highlights of the events were presentation of health hub, tour of medical facility, distribution of glasses, drama, dance, amongst others. Sika Otu for Skies Media.